Hi, my name is Jaba, and I'm working in nursery department, Bahrain Specialist Hospital. We are going to discuss about breastfeeding and breast care. First, we'll see about the anatomy of the breast. The breasts are composed of secreting glands, composed mainly of granular tissue, which is arranged in lobes, approximately 20 in numbers. Each lobe is divided into lobules that consist of alveoli with secreting cells, which produce milk. Small lactiferous ducts carrying milk from the alveoli of each lobe unite to form about 20 larger ducts. These, before opening on the surface of the nipple, widen to form ambulae, which act as temporary reservoir for milk. When the baby starts sucking, the brain stimulates the pituitary gland to produce the hormone prolactin and oxytocin. Here, the milk production happens. Milk production and milk letdown happens here. And the physiology of a milk secretion, estrogen and progesterone induce alveolar and duct growth as well as stimulate localized milk secretion. The production of milk is helped in during pregnancy by the high level of estrogens, which keeps the hormone prolactin in check. Estrogens are produced by the placenta as well as ovary, and when the placenta is expelled, the level falls. You can see the action of prolactin here. Mainly the estrogen and progesterone help in producing milk. Prolactin concentration in maternal plasma reaches maximum levels during the puerperium. By some neuromuscular mechanism involving oxytocin, the act of sucking a lactating breast stimulates in the flow of milk. Now we will see the advantage of breast milk. As everyone knows, breast milk is easy to digest. It contains protective substances which protect the child from infection. It contains anti-allergic properties which not only prevent reactions but also have protection for infants born to families with allergic problem. It's clean and sterile. It's fresh and available for 24 hours. It requires no special preparation. It doesn't need to be purchased. Breastfeeding makes a special relationship between mother and baby. Breastfeeding helps the mother to regain her body figure and has postpartum uterine involution. It keeps birth spacing in the first 4 to 6 months if given exclusively. Breast milk is suited for the growth needs of babies. Up to 4 months of age, no other food is needed. Starting from 4 to 6 months, other food should be given. But breastfeeding should be also continued. It's important for child growth in the second year of life. Breast milk contains all the nutrients that the baby needs for the first 4 months of life. It contains the most suitable protein and fat for easy digestion by the baby and in right quantities. It contains more lactose than most other milk, and that in what a human body needs. It contains enough vitamins for the baby. It doesn't need a vitamin supplement. It does not contain a large quantity of iron, but enough for the baby. Premature babies will need iron drops after birth. It contains enough water for a baby even in a hot climate. It contains the correct amount of salt, calcium and phosphate. If you are exclusive breastfeeding, you can add vitamin D. When breastfeeding is not recommended, for all such cases, the doctor should be consulted. Known chronic psychiatric cases, mothers suffering from the carcinoma of the breast, mothers on certain drugs, mothers who have breast abscess with purulent discharge from the nipple, sick mothers with infectious disease, a child with congenital anomaly like cleft palate may find it difficult to feed. What happens to the cleft palate baby? They cannot suck properly. So mother will find it difficulty. So she can but express and give the milk to the baby. And if the mothers are taking any medication, it should be consulted before starting the breastfeed. Preparation for breastfeeding during pregnancy at the time of delivery. Anesthesia, strong sedation, prolonged labor, surgical intervention, and other sources of stress, discomfort, and fatigue for mothers and infants obstruct the initiation of lactation, but persistent breastfeeding is possible. during delivery, what happen? Mothers will be very tired and they will have too much of discomfort, so they don't like to breastfeed. But if you are preparing in the antenatal period itself, it's possible, because you know the pain you have to go through, still you can breastfeed your baby. After delivery, the infant's rooting and sucking reflexes are particularly strong immediately after normal delivery, and the mother is usually keen to see and touch her child. Encouraging skin-to-skin contact between mother and infant immediately after birth and permitting the infant to suck at the breast promote mother and child bonding. When can we start breastfeeding? The mother should put her baby to her breast on the day he or she is born. It's the best to start very early, within half an hour of birth. There's a little milk at that time, but it helps to establish feeding and close relationship with the mother. Suggested duration of nursing at each breast range from 3 to 20 minutes. It depends on the babies also. Some babies like to suck for a long time at breast. Some babies, they suck only few minutes and they stop feeding from the mother. Mothers should be instructed to nurse their babies more frequently to enhance milk supply at each time babies cry for feed. It's called demand feed. Whenever you baby cry for feed, you have to feed the baby. Remember that the normal frequency of breastfeeding and natural letdown reflex will be disturbed by introducing unnecessary artificial feeds at the age of 4 months. If you want to continue with the breastfeeding, better to avoid formula milk at the early stages. Young babies with a tiny stomach need a night feed, since they can only take in small quantities of milk at a time. What happens? Mothers want to take a rest at night. So what they say, okay, sister, whole day I will be breastfeeding. Night you can give formula. But what happens? This also affect the baby's feeding, because if they are used with the bottle feed, it's easy for them to get. So they may not suck at your breast in the daytime when you start feeding. So better day and night you have to feed every 3 hourly. The long breakdown dusk to dawn without feeding can make the baby hungry, decreases milk production, and cause discomfort for the mother if accumulated breast milk is not emptied. Actually, the feeding tip is you have to empty the breast at a time. If you are started with the right side breast, you just empty the breast, then you go for left side. If the left side breast is not emptied, the next feed you have to start from the left side breast, so they will get equal amount of milk, and also the fat. The hind part of milk contains fat. The babies will get those milk. Importance of giving colostrum or first milk to baby. The first milk is called colostrum. Colostrum is secreted from early pregnancy through approximately the 4th day of delivery. It is dark yellow, sticky, and differs from breast milk. It protects the baby from infectious diseases. Regular milk comes on the 3rd or 6th day after delivery. It's a question from the mother. Mothers with small breasts, whether they can breastfeed. Actually, the small breast or breastfeed is depend on their, actually it's a tissue, but each breast contain, initially we see that in the slides, and it is only 20 lobes each breast has. So the amount of milk small breast or big breast will have same amount, so you can breastfeed your baby. The size of the breast has no relation to their capacity to produce milk. Women with small breast can and to produce enough milk by allowing the baby to suckle frequently as in any other normal situation. Previous breastfeeding experience. Some mothers have experienced difficulty breastfeeding an infant in the past. This can produce anxiety or reluctance regarding their future attempts. A careful history to elucidate the nature of the previous problem and evaluation of its relevance to future attempt is essential. Actually, we can go to the mother and discuss about the previous breastfeeding experience. Some babies, even though they are having good nipple, they will have milk, but still some babies refuse to suck breast. But still you can ask the mother and we can try first next baby, it will be succeed. The need for sterile or glucose water. The early introduction of supplemental feeding of sterile or glucose water should be discouraged. Breast milk contains sufficient water for the normal newborn infant besides the electrolyte composition of human milk, reducing the risk of infection through contaminated water. Here what happens, all our grandmothers will have a bottle with water. They say baby has to get water, but it's not recommended actually because 70% of milk contains water. So better to avoid initiating any sterile or glucose water to the baby. Positioning the baby for breastfeeding. First position we can see about the cradle position. In this position, the baby is cradled in the mother's forearm just below the elbow. The mother's forearm supports the baby's body. Mother and baby are tummy to tummy and the baby faces the mother's breast. The mother supports her breast with the opposite hand. This is how cradle position. Mother can hold the baby and it is very comfortable for the mother and baby. And cross cradle position. The positioning of the baby is the same as with the cradle position, but his head and body are supported with the mother's opposite hand and forearm. Right breast with left arm. The breast is supported with the same side hand. This position is often used successfully in the few weeks of nursing as it allows the mother more control. This is the cross cradle position. And the football or clutch position with the baby's legs and feet tucked under the mother's arm and his head held his mother's hand. It's easy to see why this breastfeeding position is called football hold. The baby's back is supported by the mother's arm. The mother's opposite hand cradles and supports the breast. Many women who have had a C-section find nursing in this position very comfortable. This is the football or clutch position. Side lying. Also a good breastfeeding position for women who have had a cesarean section. The lying down position is a good one for nighttime nursing. The mother lies her side with the baby facing her. Their bodies parallel. His head at breast height and cradle on his mother's upper arm. Her forearm supports his back and her opposite hand supports her breast. Actually, this sideline position is not recommended because mother may go to sleep while feeding. So, it is not comfortable for the baby to lying under the mother's hand. So, better to avoid if the mother is sleepy or sedated. This is how sideline position. Breastfeeding twins. Twins would be fed simultaneously or fed separately. Twins are frequently premature and the physical advantage of breast milk, especially its easiness to digest and the added protection it gives against infections are worth considering. A mother of breastfeeding twins will feel hungry than normal mothers and should take extra nutritious food. They can feed the baby at time or they can do like one at a time also they can feed. It's depend on how the mothers are comfortable. Breastfeeding twins. Double underarm hold, cradle hold, double cradle or cross hold or V-shaped hold. If the mothers are comfortable with this positioning, they can continue with the breastfeeding both the babies at a time. Rooting reflex and latching on. Babies are born with some instinctive reflexes. One of these reflexes is called the rooting reflex. A light touch to the baby's cheek or lips will signal the baby to open his mouth. The baby should latch on or grabs the nipple and outer areola into the mouth. Pediatricians test the latching reflex by putting their finger into the baby's mouth. This is the correct latch-on position. Mouth covers areola, lips are flagged out. Mouth should be wide open and the baby has to take most of the black part, that areola of the breast. Position when burped. The baby will probably swallow air with milk and this makes him uncomfortable. Thus, he should be burped after he finishes feeding from one breast and at the end when he finishes both breasts. This may be accomplished either sitting in the lap, lying him on his abdomen or by placing him on shoulder. Whatever the position is comfortable for the baby, they can continue with the burping. These are the position. And breast engorgement is due to increased blood and lymph flow at the onset of lactogenesis. Poor or infrequent emptying of the breast is the underlying cause. What we can do if the breast is engorged, we have to take good rest, bathe with warm water to ease the pain, let the baby suck more often, do not let the baby miss a feed. If it is engorged breast, actually it will be very painful, so mother has to express the milk if the mother has extra milk after baby is fed. If the baby finds it hard to grab the nipple, express a little milk to make the nipple easier for the baby to suck. Soak a cloth in lukewarm water, wring it out and put it over the breast. Let the baby begin the nursing on the fuller breast first. Use ice packs or cold wet flannel or cabbage leaves cooled in refrigerator. Breast, because breast is painful, if you use the ice pack and she will have some, mothers can have some relief. Method of expressing milk. A lactating mother may need to express her milk if she works and needs to leave milk for her baby. If she has to feed a low birth weight baby. To relieve a breast engorgement. To keep up her milk supply when she is ill. These are the time mothers express milk. This is how we can express the milk by hand. Actually, you will press near the areola, then the milk comes out. Or you can use the pump. Nowadays, the pumps are available in the market. You can use whichever pump is suitable for you, comfortable for you, you can buy and use. Best time to express breast milk. Best to express milk between feeds. Always you just feed the baby. If you express, nothing will be left. So better to express the milk in between feeds. If you express before feeding, there may not be enough to satisfy your baby. If you express after feeding, there may not much milk left. Or you could feed with one breast entirely and express the milk from the other one. Storage of the breast milk in the fridge or the freezer. Milk keeps for up to 72 hours in the fridge, not to top up an existing supply. Milk keeps in the freezer for up to 6 months, stored in sterile ice cubes, trays or bags. These are the problem actually some mothers have, so they cannot feed the baby properly. It's a flat or inverted nipple. The first picture shows is a flat nipple and the second one shows is an inverted nipple. Some women have short flat nipples. Normal nipple erects become protectile when stimulated, while inverted nipple retracts into the areola when pinched between thumb and index finger. The difference between normal nipple, flat nipple and inverted nipple. In the flat nipple, sometimes the baby can suck, but inverted nipple, it will be difficult to grab the breast. So what happens? Some babies find difficulty to suck. Interventions. Use the Hoffman technique. This is the exercise the mother can do antenatally if they are having flat nipple or the inverted nipple. Use the four fingers are placed at the opposite locations on the areola margin and then pulled outward. This procedure should be performed several times daily, 5 times twice a day, and should be continued after birth. And also we have some brush shields and brush shells or corrective device that fit over the nipple and or worn underneath the bra. Breast care. The mother should prepare herself for breastfeeding by proper hygiene. Bathing. Avoid irritant soaps. Cleaning the breast, especially the nipples. Washing hands. Changing clothes to avoid microorganisms to reach baby's milk. Creams, lotion, vegetable oils can be advised. Actually, if you are applying any cream or oil on the breast before feeding, you have to wipe it off. So better if you don't have any problem like cracked nipple like this, if you don't have, no need to use the cream, some lotion. You can just express the milk and apply. over that. So if you air dry, it will be very fine. You will not have any problem. Sore nipple. Commonly, the initial grafts and suck of the nipples will cause pain during the first few days of lactation due to negative pressure on the still empty ductules. May be exacerbated by incorrect latch on or impairment of milk letdown or the use of abrasive soaps or alcohol. What about the baby may suck initially on the empty breast for a long time. So then what happened when they suck the empty breast for a long time, it got hurts. So it start bleeding. Then you cannot feed. So better initially you should not keep the baby on breast for a long time, like 30 minutes, 35 minutes. It's like 15 minutes enough the baby to empty the breast. This is how the sore and cracked nipple looks. Treatment for sore nipples. Rinsing the nipples with water and allowing thorough air drying after nursing. Once the nipples are dry, a small amount of milk should be expressed, gently rubbed onto the nipples and allowing to air dry. If infection is possibility, topical antibiotics may be applied but washed off before nursing. Prevention of cracked nipples. Make sure that the baby sucks on the nipple carefully, not pressing on them. Mother should not pull the nipple strongly to get it out from the baby's mouth. Insert a finger into his mouth between the gum to pull the nipple out. The baby should not be left to sleep while he is sucking. After each feed, wash the nipples and let them dry in the air. Keep the skin soft by rubbing the areola and nipple with some oil. Do not let the baby suck for too long at first. Change the position of the baby. Make sure breasts are emptied regularly. Plugged ducts or focal areas of breast engorgement usually caused by stasis of milk. The condition result irregular nursing, skipped feeding, inadequate emptying of the entire breast. Treatment of plugged ducts, starting consecutive feeds on the affected side, changing nursing position often to help facilitate emptying of different lobes of the breast. Gently massaging the affected area during nursing or pumping while applying moist heat. Mastitis. This is another condition. It's a cellulitis of the interlobar connective tissue of the breast. Affected women will experience breast pain, swelling, erythema, and fever. The infection is usually due to Staphylococcus aureus and Staphylococcus species. This is the abscess actually formed in the breast. Treatment of mastitis, antibiotic therapy, bed rest, moist heat application provides symptomatic relief. Nursing should not be stopped during treatment. Feeding should be initiated on the unaffected breast and the infant is switched to the affected side only after letdown occurs. Practices to increase breast milk. Drink a glass of juice, milk or any other alternative before every feed. Avoid unhealthy beverages like sweetened artificial drinks. Increase frequency of breastfeeding during day and night. Relax and listen to the radio or watch TV while breastfeeding. Require approximately 500 calories or 25% of more food and liquid intake per day. Avoid situation and discussion that upset them while breastfeeding. If the baby is on supplementary bottles, to discontinue. Consult an experienced breastfeeding mother support group. Breast milk is the best milk for your babies. Thank you.